Back from the break, you're still watching The Morning Rush here on Metro Television with me, Desmond Okrekudanzo, and also Nanaya Tanwa Buachi. So we mentioned earlier that we're going to have a conversation about healthcare in Ghana. Today our guest is someone who's been around for quite a number of years, 23 years since he first stepped on this soil, and he's been doing a lot of good for our healthcare system in the country, helping bring in people, also doing some free surgery stuff and all of those things over the years. And this morning, I want to talk to him and understand his perspective of our healthcare system in the country. I mean, from back in the days when he first came in 1999 and this present moment that we find ourselves in. A lot of people in Ghana do complain about the system, and I want to know if, really from his perspective, it is same. And so let's get into the conversation with Dr. AGHA KAHN, who is a neurosurgeon, and it's a privilege to have you join us. Good one is that you're welcome.
Thank you very much. It's my pleasure to be here.
Yeah, I'm sure by now you know the Aquaba and all of those things.
Yes, I do.
All right, good to have you. So you first came in 1999.
That's right. I came in November of 1999, just to see how things are and what can we do to help. And then I came back with in August of 2000 with a team of 14 people. We spent 2 weeks at Korlebu and around, and did a lot of work, did a lot of surgery, and then we continued to come since then, multiple times a year. And I used to come for a couple of weeks at a time, but I've been coming here now for longer periods. Okay,
great. So I mean, I asked when you came in because I just wanted to understand why you decided to leave where you were and choose Ghana to come to this place and help out. You know, as you mentioned later, you brought in some health personnel who came in to provide services. Yeah, 1999, I was very young then, so I wouldn't know how things were back then. But when you got to Ghana, how was the system like, the healthcare system back then?
Well, Ghana that you see today and Ghana in 1999 are two different countries. It was still nice, people are nice, and resources were scarce. Very little in healthcare also. You see so many hospitals now and so many facilities, hotels, roads, and buildings, government buildings, everything. It's a whole different world. So compared to then, it was like a small glorified village or town in 1999, if that's we can say that without offending anybody, but that's how it was. And traffic was still horrible, but it's only because, mostly because there were hardly any roads, and whatever roads were there, they were broken. But I think what I must say, the Ghanaian has their heart in the right place, and they're very helpful and welcoming, want to help, participate. So we had a lot of cooperation, a lot of help. There were many names I can talk about who helped me build from the very beginning. And some of them, there was a Dr. Fifi Ellis at the Trust Hospital. He was introduced to me by Dr. Kweku Last, who's still, I think he works at Eurocare. There was Dr. Idrisu of Korlebu, and Dr. and Amir Wahab of Ahab Adam of Ahmadiyya Muslim community.
Oh, okay. So when you arrived in 1999, where were you stationed?
Labari Beach Hotel.
Which hospital?
I get that.
Yes, I get to. Which hospital to be specific?
Korlebu.
Okay. And comparing that time to this time, I mean, Kolebu has developed over the years. You could see that different surgeon units have been added on. Where were you stationed in particular?
Labari Beach Hotel. There was no station. There is I think it was second floor of Kolebu.
Okay.
Was neurosurgical floor. And I would go, and the operating rooms, operating theater, they call them here, were there too. So we would go, me and my team, as I said, we were in the hotel because there were no living quarters by the, and not so many anyways, at the hospital. So we would just go see the patients, check them out, see what they need, and decide what surgery they need to do.
Okay.
So we'll go to the operating room or operating theater and perform whatever we need to be done, and then we come back, and we had residents. There were some doctors that I trained very closely, Dr. Okoto and Wapaba and there are a few others. Banca, Dr. Banca, and of course I was working with Dr. Idrisu and other staff. So we had it was a good experience.
So the system over the years, I mean, what were some of the challenges that stood out for you at that period and even through time to this present moment?
Well, we had organizational problems, we had structural problems, we had equipment problems. For example, we didn't have a good working microscope or what is called image intensifier and all that. And other things, and I was bringing a lot of stuff with me from America. But together we managed through, and we did some very complicated and difficult surgeries. So it was we're moving forward with a positive attitude.
Okay.
Yeah.
And over the years, have you seen those challenges being fixed or being improved?
Well, there's always a room for more improvement. But yes, they have been improved, and the surgeons I named, they have really improved. They have done well, and they're in the senior positions, as you can imagine. So the building still, I think, is being refurbished. There are some new wings, especially the urology wing that has been added on. But it takes a lot of organization, a lot of money, and a lot of vision to do things and to improve such a big hospital as Kolebu is. It's not an easy task.
Yeah.
But I see there's construction going on there. So,
yeah. I mean, over the years, you've been doing more with regards to the healthcare system. And for someone who's a health practitioner, you have the will. You want to provide healthcare and other things. If you, from your perspective, for the passion and everything, though it has been improved, there's room for improvement, what do you intend to do more? Even though you've done more to this country, what do you intend to do more moving forward?
I think there came a point where I decided that I was coming and doing things and leaving, but it was not making as permanent of a mark as I wanted to. So I had a vision of building a neurosurgical or medical surgical facility. So we started looking for the land. Lots of people helped me. Dr. Wapapa and I remember, used to go and look around for the properties where we can do this. And so it's been a long journey. We talked to lots and lots of people, and meanwhile we continue to work and come with the team. So we ended up buying land in the, I was going to build a university and go towards Dodowa and Okosombo, and those areas, because land was plentiful then. But I also realized that we need to be in the center of the population.
Yeah.
So we came across this land right in the behind Burma camp, which is now East Airport, it's called, and Muhammad Road. You probably remember where the military cemetery is. So we acquired about 5 acre plus in that area, and since then we have built a multi-specialty center, which I'm proud of. But that's because I got so much help and so many people who helped me build that. And so it's a center of excellence now. We have all the modern machinery. We have a very good quality radiology department. We have MRI, CT scan, X-rays, ultrasound, all those things right in one place, instead of running around town getting one thing done or another. So it's all done at the same place. We have a surgical facility. We have a patient, we have physiotherapy, we have dental facility. We also have a ENT. We're about to get, add some of the more specialties. And the main thing is that after that, we are going to use that facility as a teaching center as well.
Okay.
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 So
That's great. That's great to hear. So you are a specialist when it comes to
neurosurgery.
neurosurgery, and I mean that bit of it. I mean, I was just reading about it, that it's about the nervous system and all that. Over the years, do you think that, as Ghanaians, we even understand what that really even is, and why? I mean, even if we have enough people, enough neurosurgeons, in the country to be able to work on situations like that.
I think we have, it's just several aspects to improve a service.
Okay.
So I think we have some good neurosurgeons, some very good neurosurgeons here, and many have been added on since when I first came. For example, Dr. Drisu and I were talking, and he said, I'm the only neurosurgeon for 22 million people at that time. But now we have many more neurosurgeons, and we have Ridge Hospital, which has been redone, and Korlebu has improved, and several doctors there, and they're in Tema, and then Kumasi and Tamale. There are other neurosurgeons. But it's the general system. I think we have to provide what they need to do a good job.
Okay.
And that's a thing. We slowly have to work together and do what needs to be done, and eventually I intend to, God willing, make a neurosurgical center and pull all these resources and all these doctors to bring and come and work at one place.
Okay. Also, my next question really is about when you're having a surgery. I mean, I'm just thinking, we know that surgeries happen, they do a lot of, but to work on a person's brain, I mean, that must be crazy. What have been some of the experiences like, if you could share, so myself and her and viewers could understand what really that whole situation is like, working on somebody's brain. Like, when something goes wrong, everything is wrong.
Then oh my God. No, it is well said. It's not something you take lightly, and it's scary if you don't know what you're doing. You have to have a certain amount of confidence, actually a lot of confidence, that what you're doing is the right thing. And you have to have good planning, and you have to have good training and good equipment and all that. So all those things you have to put together, and then as a doctor, as a facilities, and all that. So brain and spinal cord, very, very, very special organs. It's not like others are not, but I mean, yes, you are right. If you don't plan it right and you make a mistake, it can be very costly for the patient. So,
wow.
So everything has to be well planned.
One of these days, when next you have a...
We should be invited.
I'd want to see how it works.
Yeah.
So,
You come and see our, we have not live surgery for that, but we, at our center, it's called First American Specialty Center, and then we have areas we can do, and then we're going to have,
right.
we can have a training center on cadaver training
Okay.
surgeons, and I had similar things in America. So I transported a lot of that stuff to Ghana. So yeah, I think you're welcome to come anytime. Anybody is welcome
Thank
to
you.
come.
Okay. All right,
Thank
sure,
you.
sure.
Thank you.
Doc, thank you so much for coming in this morning and helping us understand what you've been doing in the country for all of these years, 23 years and counting, helping our healthcare system in the country, bringing in people to provide services to us. We're grateful to you.
Yeah.
And we're always here, and we're thankful to you that you came in this morning.
Yeah.
Yep.
Thank you for inviting me. It's my pleasure. Anytime.
Okay.
Anybody wants to come and see us at the center. And
Okay.
thank you.
Thank
And
you
too.
too.
Okay, so that was Dr. AGHA KAHN. He's a neurosurgeon. He's done so much in these last couple of years, 23 years, and then we just had a conversation with him about our healthcare system in the country.